my name is Michaela Mace, and through this video, I'm going to teach you what a speech therapist is. So when I grow up, I want to become a speech therapist, and as I've realized, a lot of people do not know what a speech therapist is or what they do and how they help the community. And so through this video, I hope I can teach you just that and let you know a little bit about why I want to become a speech therapist. So, what is a speech therapist? A speech therapist basically explores processes that underlie speech, language, or hearing. They diagnose certain disorders that may hinder someone from learning as efficiently as they want to, or cause someone to have the inability to pronounce certain words or sounds. So these disorders may be caused by numerous amounts of things. They could be caused by neurological disorders, brain injury, mental retardation, emotional disorders. It could be caused by problems in the home. And for example, the family may not be teaching their child as early or as efficiently as they should be. But most often the causes are unknown for a communication disorder, and what speech therapists do is they diagnose these disorders and they treat them to the best of their ability. So I'm going to teach you two types of communication disorders that are most common. So first off, we have speech disorders. And speech disorders are disorders in which it's hard to pronounce certain sounds or words for a person. So one type of speech disorder is stuttering. And stuttering is very common. Most people know what it is. It's a disruption in speech either before or during, and it's caused by repetitions of sound of certain words, or just words in general. So, for example, I watched a video of this one woman who couldn't pronounce words starting with ST. So words like stop or stuck, or even the word stutter, she could not pronounce it fluently, or the words couldn't flow nicely because she had the stutter when she pronounced those words. So that's one type of speech disorder. And the second type of speech disorder is articulation, problems of articulation. And that is problems with speech sounds, certain speech sounds such as mixing up R and W words. So for example, a child may say wabbit instead of rabbit. And that may not be a problem at such an early age for a child, but when they reach a certain age where they're supposed to be pronouncing words and sentences correctly, that's when a speech therapist needs to come in and fix that issue to the best of their ability. And so those are common speech disorders, and that's what a speech disorder is. And next we're going to talk about language disorders. So language disorders are disorders in which a person cannot process language as quickly as they want to. They can't comprehend it. It takes longer for them to understand it in order to form a response back to the person they are talking to. And so one type of language disorder is aphasia. So aphasia is damage to the brain where language comprehension is essential. And so that may be the Wernicke's area. So problems to those areas of the brain may cause a person or a child to have problems articulating language, processing it, understanding it, wrapping the words around their head. So what speech therapists do is they help these children articulate language better by giving them practices, skills, or techniques in order for them to understand language better and to be able to form a response quickly. And I've had past experience with these two types of disorders. So first off, I teach at a church. I've been teaching for 2 years, and I teach kids from ages 3 to 6. There's two kids that I've taught that have communication disorders. First, I'm going to talk about Elsa. And Elsa has a speech delay. And this means that when I talk to her, it takes longer for her to respond to me. And also, it may take longer for her to understand what I'm saying to her, so that requires me to have a lot of patience. I have to speak slow to her, make sure she's understanding what I'm saying, getting to what I'm asking her, and she has to form a response in return. So Elsa has a speech delay, and with that speech delay, I just have to be patient, and I have to make sure that she's staying engaged in the class, making sure she's not feeling left out amongst the other kids, and I have to make sure that she gets to learn just like the other kids. And next we're going to talk about Charlie. So Charlie, I do not know what communication disorder he has because his parents never specified it, but all we know is that you have to make eye contact with him when you talk to him, meaning he has to look at your eyes, he has to make sure he's looking at your mouth to understand what words you're forming and what you're speaking to him. And when he's distracted, this becomes hard for me because I have to make sure he's paying attention and I have to make sure he's understanding what I'm saying so he can be able to learn, and that way he won't feel left out of the group. So I have to maintain eye contact. Sometimes I'd have to touch his shoulder or his arm to make sure he's looking at me when I'm talking to him, so that way he won't feel left out. And so those are two children that I teach at church that have communication disorders, and they basically motivated me to work specifically with children when I become a speech therapist. I want to make sure kids with communication disorders have the ability to learn. I want to make sure kids with communication disorders have the ability to learn just like the other kids who don't have those disorders and who could lead those normal lives that they want to live. So I want to make sure that they're still able to learn. I want to make sure they're on top of their studies. I don't want them to feel left out or feel lost. So I want to work specifically with kids in this occupation. And with this occupation, I get to work with other specialists such as psychologists, social workers, audiologists to further help these clients. And I also get to work in different environments such as schools, hospitals, or even a private clinic. So that's what I'm excited to do if I become a speech therapist. It's going to require a lot of patience and creative thinking because no two patients are going to be the same. They may have the same disorder, but the severity of the disorder may be different, which requires me to come up with different techniques and skills to use to treat these patients. And so I hope you learned a little bit about what a speech therapist is, what they do, and I hope you enjoyed this video.